Good afternoon. My name is Dulce Guzmán, Executive Director of Alianza Americas. Before we begin today's webinar, we want to ensure that this is an inclusive and accessible space. So we are providing self-descriptions of the panelists and myself, the moderator, so that those who cannot see us or need additional description can have access to it. We would like to note that this conversation will take place in English and in Spanish. Panelists will respond in the language that they are most comfortable with. So we invite you to access interpretation by clicking the globe icon at the bottom left side of your screen. Antes de comenzar el seminario
Before we begin today's webinar, we want to ensure that this is an inclusive and accessible space. This is why we shall share a brief description of the panelists and of myself as the moderator. For those who cannot see us and need an additional description, they can have access to it. We also would like to note that this conversation will take place in English and Spanish. Panelists will respond in the language they are most comfortable with. To access interpretation, please click the globe icon at the bottom left of your screen. Now I shall begin in English again.
Welcome everyone. Thank you so much for joining us today. Once again, my name is Dulce Guzmán. I am wearing a purple blazer with a light pink shirt that has pearls at the top of it. I have long brown hair with a whitish greenish background. I want to introduce Alianza Americas. Alianza Americas is a national network of 55 Latin American and Caribbean immigrant-led organizations working to create a more equitable, sustainable, and dignified way of life for migrants in the U.S. and in our countries of origin. Today, we are gathered to reflect on the first year of a very important initiative, Bienestar, Estar Bien. Bienestar, Estar Bien is a project of Alianza Americas working to address barriers to accessing mental health through educational workshops, capacity building, narrative change, and data collection. The need for mental health support among Latino and immigrant communities has always been urgent, but during the COVID-19 pandemic, our members heard the recurring call for additional support that many times was not accessible. And now many households, including immigrant families, are experiencing the compounding pressures and fears that have a negative impact on mental health. Many people are living with constant fear, uncertainty, political attacks, the impact of family separation, economic instability, and deeply traumatic experiences. At the same time, we are witnessing federal funding cuts to mental health programs and other important services, a shortage of providers, and growing demand for emotional and behavioral support. That is why we believe the Bienestar Estar Bien model is critical in this moment, because it does not wait for people to successfully navigate complicated systems on their own. It brings education, tools, and support directly to the community. This project is rooted in something incredibly powerful, the trusted relationships and voices that already exist within our communities, which are community-based organizations and their community health workers. We have been working closely with two of our member organizations here in Chicago, Centro San Bonifacio, who joins us here today, and Centro Romero, who is also based in Chicago, to bring community education workshops on mental health topics relevant to our communities. We have also provided adult mental health first aid certification training in Spanish to their staff and volunteers in an effort to build capacity among organizations to better understand mental health, how to support someone in need, and connect them to available resources and services. Another central part of this initiative has been gathering information about people's lived experiences, understanding the barriers they face in accessing care, the challenges affecting their mental health, and what communities say they need in order to heal and truly thrive. Today, we are very proud to share our Year 1 report. Between March and December 2025, we collected 358 surveys from individuals who participated in Bienestar Estar Bien workshops across Cook County. These responses reflect deeply important insights about stress, fear, isolation, economic barriers, and the difficulty many people face in accessing affordable, culturally responsive mental health services. But we also heard something incredibly important. Our communities want to talk about mental health. They want tools, they want community support, and they want services that truly understand their realities and their experiences. In just a few moments, we will unpack a few of the report findings during our panel discussion, and we invite you to click on the link that was shared in the chat so you can learn more about the report findings. Thank you again for being here, for joining us in this important conversation. And now we will introduce our panelists. So I invite you to come on camera. And as I introduce you, I'll give you a few seconds to describe yourself. So we'll start with Zoraida Ávila, who is the Capacity Building and Wellness Specialist for Alianza Américas. Welcome, Zory. I'll let you describe yourself.
Muchas gracias, Dulce.
Thank you very much, Dulce. Greetings to everybody accompanying us. I am Zoraida. I am wearing a pink blouse, a flowered blouse shirt, curly long hair. I'm wearing glasses with a blue frame. And behind me, you can see some paintings and drawings.
Thank you. I'd like to now present Jennifer Brothers, Executive Director of the Impact Fund and Community Services at the Cook County Health Office of Behavioral Health. Welcome, Jennifer. I'll let you describe yourself.
Can you see?
No, we don't see you.
My video started to work, but then that now is not working. I apologize. I don't know why. Well, hello, everyone. My name is Jennifer Brothers, and I'm the Executive Director of the Impact Fund and Community Services for the Office of Behavioral Health. I have blonde, brown hair and glasses, and I'm wearing a tan sweater.
Thank you, Jennifer. And now I invite Alejandra Menéndez to come on camera, Executive Director of Centro San Bonifacio, a community-based organization serving immigrant families and a member of Alianza Américas.
Hola a todos, un placer.
Hello, everybody. It is a pleasure. Thank you for inviting me. My name is Alejandra Menéndez. I am wearing a white blouse. I have a pearl necklace. My hair is brown with some blonde highlights. I'm also wearing purple glasses.
Thank you, Alejandra. And thank you all three for joining us today for this important conversation. We're going to start off with the question for all three of you. Access to mental health, especially among people of Latin American origin, has been an increasing need. And now, under the political and social instability we are experiencing, the need has only increased. What are at least one or two of the main challenges you identify in terms of access to mental health care for those affected? And I'll read this one in Spanish too.
Access to mental health, especially among people from Latin American origin, has been an increasing need. And now, under the political and social instability we're experiencing right now, this need has only increased. What are at least one or two of the main challenges you identify in terms of access to mental health care for those affected?
We are going to start with Zory, if that's all right.
Gracias, Dulce. I'm going to do it in Spanish.
Thank you, Dulce.
Primero,
First, I would like for us to be aware that approximately 5.5 million boys and girls born in the U.S. live in homes where at least one member of their family lacks migratory authorization. 1.8 million of boys and girls live in homes where both parents lack this authorization. And I want to begin with these numbers because this tells us what are one of the challenges that we have in our community. The lack of access to health programs, the lack of access to assurances, I'm forgetting the word right now, to programs for health expenses. And I think that the system that we currently have has several gaps in order for the community to be able to access health services, especially thinking about mental health, which we are seeing how this has how these affectations has gone up. There's more anxiety, more stress, which impacts not only the person that experiencing it, but also the families themselves. So I think that all of these aspects that we have a population that lacks protection when it comes to health and a system that is very complex so that the families can obtain this access to health, which makes the prevention more complex, leading to people to for people when they go to receive these services, they're suffering from chronic problems because of the financial aspects and emotional aspects. So you're adding several factors that influence the challenge that we find when it comes to accessing health services in general, but focusing on mental health.
Thank you, Zory. Alejandra.
Gracias, Dulce. También lo voy a
Thank
decir en
you,
español. Sí,
Dulce. I
creo
was
que
also speaking in Spanish. I think that
apoyando lo que dice Zory,
adding to
uno
what
de los
Zory
grandes retos
mentioned, one
es
of the
esa
big
parte, ¿no? Del
challenges is
acceso
that
a lo
part
que es,
of
muchas
access
familias no
to
tienen
where
acceso a
many
un seguro
families don't
médico, un
have
seguro de
access
gastos médicos para
to
salud mental.
medical insurance
Entonces, el
or
costo es demasiado
mental health
elevado.
services. So the cost is
Entendamos
too
que nuestras
high.
familias migrantes, la
We
mayor
see
parte de
that
ellos
in
son
majority of our migrant
personas
families
de,
are
digamos,
people who
de la comunidad que son
from the
trabajadores,
community
que su
who work,
ingreso también
which
no
is
es tan
an
elevado como
income
para
that
poder
isn't that
costear de
high
manera
of an income
privada
in order
un acceso a la
to
salud
have
mental
access
por cuenta
to
propia. Sin
mental
embargo,
health
debido a
services
los
on their own
estatus,
or
¿verdad?
private
Tampoco es que ellos
services.
cuentan
And
con la
also it's
posibilidad
because of their
de
status, they don't
acceder a
have the
los
possibility
servicios
to
públicos de
access
seguros
public
médicos.
services
Entonces, creo que
for
ese es uno de los
medical
principales retos.
coverage. So one
El
of the main
segundo reto que yo
challenges,
he
that's one of the
visto
main
dentro de mi
challenges. The
comunidad
second one that
también
I've
es
seen in our
cuando
community
ya
is when
hemos pasado, ¿verdad? Esta
we
barrera de conseguir dónde puedan tener
surpass this
un
barrier of where they can
acceso a la salud
obtain
mental
access
que
to
sea a un
mental
costo
health
bajo para
services
ellos,
at
es
a
la
low
lista
cost
de
for
espera.
them. The other
¿Verdad?
challenge is the
Tenemos
waiting
un
list.
déficit
We
en
have
cuanto a
a
proveedores
deficit
de
when it
salud
comes to
mental,
mental health
sobre todo para el
providers,
área latina,
especially for
porque
the Latin
hablemos también que
population,
es el
because we
otro
also have
reto,
to
¿verdad?
mention that's
Sentirse
another
conectado con
challenge,
la persona de
feeling
donde vas a
connected
recibir
with
el
the person
servicio.
where they're going to receive
No,
the
muchas
service.
veces no es
Many
solo el
times
idioma,
it's
sino es
not
la
only the
cultura.
language, but
Entonces yo creo
also
que estos
culture.
han sido
So I
grandes
think
retos que
these
yo he
have been
visto,
great
que he
challenges that I have
escuchado de mis
seen, that I've
participantes en los
heard from
programas,
my participants in
que
these
han
programs
limitado
where
bastante el
they've
acceso
limited
a
the
una salud
access to
mental, el
mental
atenderse,
health
y sobre
services,
todo pues estamos viendo el
especially
impacto, ¿verdad?
because
Al
we're seeing
tener
the impact
esta
of
falta de, pues
when we're
vienen las
seeing
consecuencias
this
de las que pues
lack of
hablaremos más
services,
adelante, pero
we
como
see the
retos yo
consequences that we
pondría
shall
esos
discuss later on.
principalmente.
When it comes to challenges, I would mention those
Thank you,
primarily.
Alejandra. And Jennifer?
Okay, thanks. So I think that, given everything that's going on, the political and social challenges that we're seeing, we know that many individuals and families are experiencing significant stress, anxiety, and uncertainty related to economic pressures, immigration concerns, and discrimination that can directly impact their mental health. At the same time, many people do not know where to turn or may delay seeking out services until a crisis occurs, given everything that's going on. I think another major challenge is access to culturally and linguistically responsive care. Individuals we know are more likely to engage in services when they can receive care in their preferred language, and for providers who understand their culture and their experiences and their community context. And unfortunately, there continues to be a shortage of bilingual and bicultural behavioral health professionals across the region. And then, as you kind of alluded to earlier, we also know that stigma remains a major barrier. In many communities, conversations about mental health can still be difficult, which really can prevent individuals from seeking support early. That's why trusted community-based organizations such as Alianza Americas play such an important role, because they often serve as the first place individuals and families turn to when they need support or information or help navigating services.
Thank you. Yes, I think many of the things you all mentioned, the cost complicated systems. I think the healthcare system in general is difficult for someone who does have a steady income, who does speak the English language. You can only imagine for a mother who, probably is working multiple jobs or doesn't speak the English language and doesn't have access to insurance. How do people navigate these systems? And a lot of times it is community-based organizations that are doing that work. Interestingly, one of the findings in the report, of the 358 people that we were able to survey, just about 60% did not have insurance. And as you said, Jennifer, a little bit ago, when we're speaking and creating these spaces for community, you unpack the silence because they want to go to these types of services. They want that help, but it's just finding the space and really creating the accessibility to make that happen. Thank you. I'm now going to turn to Alejandra. I want to ask you, Centro San Bonifacio is one of the organizations that we are working with to implement this project. Can you share more about what challenges your community and organization is facing? How is this affecting their mental and emotional well-being?
Sí, claro.
Yes, of course. Well, thanks to Alianza Americas, we had the opportunity to work on this project. Previously, we have been working on projects that address mental health of the population. In particular, here in Centro San Bonifacio, we work on prevention, how to prevent before we arrive to a crisis regarding mental health. We offer support as well as training, for example, how to develop techniques that help us to deal with or surpass the challenges we face in life. However, one of the big challenges that we have here is what we mentioned when it comes to the access to mental health is capacity. As community organizations, it's not as if we have so much staff or so much support as our community needs. So we reach a moment where we are a bit overwhelmed when it comes to being able to provide for the community because the need is huge. So what we've done is we've done partnerships with other organizations. We try to support everybody that comes here asking for help. And what we've had to do many times is refer them to other organizations and then see that they are also overwhelmed. So we have to find where these people can receive the help they need. It's a big challenge to be able to provide attention to everybody who needs it. I think that the part that we work with during the workshops is prevention has been of great help because at least there we can share what it is that they can do from their homes in order to be able to overcome the stress and anguish because of the political situations that we are or economic situations we are facing. However, the challenge is to be able to provide attention to everybody because we are a big Latin community and we already discussed that the access for mental health services when it comes to clinical mental health services is very limited for our community. They come to our organizations, but many times within the organizations, the capacity that we have for the people is sometimes we find ourselves lacking to be able to help. And as I mentioned, when we refer them to other organizations, they are facing the same challenge that they are saturated, that there isn't enough space. So the challenge is, what are we going to do with all this population that sometimes the waiting list is very long, even within our organizations, because of the fact that it requires more attention, it requires greater effort, and it requires more resources for the community.
Thank you, Alejandra. Yes, we've heard from our member organizations, not just in Chicago, but in other parts of the country as well, that there are very long waiting lists, not only for their services, but also for referrals, as you said. I think also we should recognize that there has been an unprecedented amount of federal cuts to programs that fund some of these mental health services, that fund critical social services, that provide food assistance, that provide other types of health-related support, and that is just exacerbating a problem that already existed. So thank you for sharing that. And I also wanted to highlight something that you said about the important role of staff, because I think nonprofit staff is on the front lines seeing people, and sometimes that same nonprofit staff is experiencing some of the same things that the people we're serving are experiencing. So for Alianza, it was important to provide certification in mental health first aid as an additional layer of support or capacity for organizations. So thank you for sharing that. Jennifer, I want to turn to you now. We are aware that Cook County has made several efforts to better understand the needs and challenges in our existing services for behavioral health. And you've alluded to some things regarding workforce. So can you share a bit more about what you are seeing in terms of access to these highly needed services? And in particular, what are those workforce needs?
Yeah. Well, over the last few years, Cook County has worked closely with our community organizations and providers and residents and system partners to really understand both what the behavioral health needs are and the barriers that people are facing when trying to access care. And what we consistently hear is what we kind of already have mentioned earlier is demand for services continues to outpace capacity. People are facing long wait times. They're having a difficulty navigating a fragmented system, trying to get through what's the right door to enter, challenges identifying available providers, and barriers to transportation, language, insurance, and costs. So even if you find that provider, can you get to them? Can you pay for them? What is the cost? One of the most significant challenges is the behavioral health workforce shortage. We conducted a Cook County behavioral health workforce assessment a few years ago, and we found that the workforce needs to grow by approximately 50% to meet current and future demand. That's a significant amount of workforce. At the same time, many organizations are struggling to recruit and retain. You talked about those frontline staff. It's hard. This job, behavioral health is such an amazing field. It's a rewarding field, but it's also a demanding field, right? And so how do we not only recruit, but we need to retain that staff and take care of them, particularly bilingual and bicultural providers, our peer support specialists, our substance use counselors, our case managers, our mobile crisis responders, and our licensed clinicians when we think of our social workers and our psychologists and our psychiatrists. The shortage is especially, concerning because representation matters. I believe that representation matters no matter what field we are, but especially in behavioral health. Our workforce really needs to reflect the diversity, the gorgeous diversity of the communities we serve. When we know that as I mentioned earlier, when individuals can receive care from providers who understand their language, who understand their culture, who understand their lived experiences, we know that not only engagement improves, but the outcomes, improve. So recognizing this challenge, we developed the Cook County Behavioral Health Apprenticeship and Retention Hub. And it's a workforce initiative really designed to expand and diversify the behavioral health workforce through paid earn while you learn pathways. So we know that the traditional pathways are not working to meet the needs of our workforce. The idea that, a person is going to go into significant debt and then, leave college in debt and then have to go into the workforce is not working out for a lot of people for a number of reasons. So how do we change the environment? How do we create pathways where people can earn while they, learn and create that? So that's what we are doing. So we're trying to figure out ways to build those pathways into both early entry pathways, such as, your certified alcohol and drug counselors or your peer support specialists, to eventually looking at those more advanced clinical pathways, such as that licensed social worker or that counselor. So we're trying to find ways in which to reduce financial barriers to entering the field and creating those clear pathways so that everyone can succeed. We also recognize that this can't happen in isolation. So this hub is really made up, and we continue to build and expand it, of community-based organizations to be a part of that, to build their workforce and to ensure that services remain connected to the communities in which they serve. And ultimately, we hope that this workforce initiative really builds a robust and representative workforce that we need to really truly improve access to care.
Thank you so much, and thank you for sharing that regarding the earn while you learn pathways, because as you said, and I said earlier, there have been funding cuts that have also affected higher education. It is an incredible difficult time to be a student right now. So things that local governments can do, as Cook County is doing, is provide avenues so that people feel supported and not only enroll, but also are able to complete the programs to join the workforce. So thank you for sharing that. I want to invite our audience guests to feel free to drop in your questions in the chat. We will have some time at the end to get to those as well, so please feel free to include them. Zory, Alianza Americas is a network of immigrant-led organizations, and we made a specific choice to work on capacity building for organizations. While we can't address the workforce issues, as Jennifer mentioned, we are trying to at least grow an additional layer. So understanding this project does not address that. Why is it important to work with trusted voices and grow mental health first aid certification and training among community organizations?
Gracias, Dulce.
Thank you, Dulce. These types of programs are an opportunity for organizations like ours because precisely understanding what Jennifer mentioned, the demand grows and the capacity is reduced more and more. We have to acknowledge the work, and just like Alejandra mentioned, the work of the community organizations, which has been fundamental and historic when it comes to the accompaniment for the communities where they are centers, where they generate a safe space for the community with which we work. The families know that besides what they find, information, educational programs, there's a diversity of programs, legal counseling, education, health, etc. It's a space where families feel safe, they feel protected, and its part, Centro San Bonifacio, for over 40 years has been working with the community, with the health promoters. So this type of program of Bienestar, Estar Bien, gives us the opportunity to work to strengthen the work of the organizations themselves, that the work they're carrying out in building capacities with mental health first aid certifications. And as we mentioned from the beginning, the world is churning in a way where the demand is growing when it comes to the demands for mental health services. We see the families, as I mentioned previously, being affected by stress, affected by anxiety, by physical conditions. And this surpasses or exceeds the capacity for mental health services. Jennifer mentioned the barriers, transportation, stigma, money, time. We have families that have 2 to 3 jobs, and also the lack of information. The other day at a workshop, a person told me at the end of the workshop, I didn't know that emotions cause damage, that emotions matter. So it's important to generate these spaces for information and accompaniment. And this is what we do with this program of Bienestar, Estar Bien. We go with the organizations, we accompany them, and we strengthen the work that they're doing with the population. It's not that we're generating or creating therapists, dozens of them. We are providing tools so that this population that we accompany can have more access to this information. The results of our surveys that we applied during the first year that we worked on this, we saw, you mentioned, the families don't have access access to medical insurance when it comes to the majority of the population, and they don't also have information. So the community organizations are this key point where they can provide this information, and by developing and strengthening this capacity, like for example, accompaniment in mental health first aid, it's help they can provide to the families regarding where they can turn for help. Obviously, the demand is very high. The other day, a person told me that they sought a Spanish speaking therapist and I received an appointment until September. What am I going to do with my anxiety until September? I can't get rid of it. Those are the realities that we face. And as nonprofit organizations, we are also finding ways to help solve or tend to those gaps. In Alianza Americas, we've been doing work from different perspectives, and since the pandemic began, we started with this focus on focusing mental health and the access for the communities in their own language. And we're not thinking not only information in Spanish, but thanks to the organization that we work with, we've developed material in indigenous languages. The organizations are working with populations from Guatemala, Mexico, in Quiche and Mixteco populations, and they were the ones that provided support to develop this type of material. So, in the development and supporting capacities, how we are expanding this information so that the populations can have this access that the organizations are giving. And to not take up too much time, why do we do this purposefully? Because we've been constructing and building the capacities of our organizations, and because it has been a fundamental part in the organizational process, in the resistance, in the education, and in providing information. And it's part of the work that from Alianza Americas, and thanks to the member organizations and that they participate in California, New York, New Jersey, and doing this work with the organizations here in Chicago, it allows us to amplify or expand greater access to the information and also recognize or acknowledge needs that we can speak with the state authorities and tell them we can see these gaps, we can see these needs. So how can we work together in order to provide a better accompaniment to these families?
Thank you, Zory. Very, very well said. While we can't have or create, therapists overnight, there are this nonprofit staff, community health workers, navigators who have established decades-long relationships with these communities, and they're the first people that community turns to when they're looking for something. So thank you for sharing that. And I just wanted to add that the adult mental health first training is something that anybody can take. You can find it on the National Council for Mental Wellbeing, and we recommend anyone that's interested in just having that knowledge to do it. It's similar to CPR training or something, somebody is experiencing shortness of breath or something like that. This training allows you to recognize what those signs are and how you can help somebody in that moment while you're connecting them to support. So thank you. Now we're going to turn to talk a little bit more about the specific report findings. And we've touched a little bit on some of these things, so we're going to go a little bit deeper. Alejandra, the report mentions that about 40% of the people that we surveyed reported it being very hard to access the mental health services they need. Can you share what some of those reasons are? What makes it so difficult for somebody to find a therapist or to find a clinic that they feel comfortable with?
Sí, bueno, la principal razón ya la
Well, the
mencionamos.
main reason was already mentioned. The first one is the lack of access to medical insurance, which causes that when you don't have this insurance, you have to cover the cost of yourself. So these are families. You already mentioned that some of them have even up to 2 to 3 jobs just to get by the basic of their expenses for their life. So many times they do need it, but they can't access it because they can't afford it. That's the reality. They don't have the money to pay for a therapist. Therapists are expensive. And as I mentioned, the organizations try to find a place where that could be a low cost for these services. And when we find these low cost locations, the next challenge is that the waiting list is very long for distance because it's very far. We've had cases where the people that we refer to them are have an urgent need and we get an appointment, but it takes a 30 to 40-minute drive there. And sometimes they don't have a vehicle to drive that distance and public transportation would imply 2 hours. So it would be 2 hours to get there, an hour for the appointment, and then 2 hours to get back. So that makes it very difficult for the population to access it this way. Primarily, those are the circumstances that making it very difficult for people to truly have access to mental health services. And I'm going to mention it again. It's not that easy to obtain or to find somebody that understands your culture. So that's another of the things. We do have therapists, and we've been able to contact therapists that speak Spanish, but at least when they come here and they say, I need to find someplace else. So we ask, why? Why aren't you? Were you treated badly, or was it a bad service? And they say that I feel that they don't understand me. So that's another of the big challenges, and which makes it very difficult to get somebody to, or for somebody to have access to mental health services that actually works for them, because mental health is something very specific, very delicate, that they have to connect with something that goes beyond a language. They have to connect with their culture. They have to connect with their beliefs. They have to understand their life experiences. They have to understand why this person finds themselves in the situation. And this is obtained through common experiences, through a common culture, even sometimes common stereotypes that our cultures have. So this lack of therapists that understand culture, that understand the experiences, that share these experiences, makes it more difficult. So we find ourselves in situations where they don't have a medical insurance, so we solve that issue. We obtain low cost. The waiting list is long. We reach the date of the appointment, and the person that they have to connect with there's no connection, because they do speak the same language, but they don't connect because they don't understand themselves because of different cultures. So in my experience here in Centro San Bonifacio, that has been the reason why people find it very difficult to have access to mental health services.
Thank you, Alejandra. That is a long process for some people to only end up not feeling comfortable or not feeling understood. And what you mentioned, language is just one thing. It's also about understanding the culture, the way that people are brought up. Many of the people that we have been working with have been living in the U.S. for 30 to 40 years and are now going through different challenges that perhaps somebody that's, in their 20s or 30s does not understand. So there's definitely very nuanced ways of doing this. So it goes back to a lot of what you said, what Jennifer highlighted with the workforce issues. So there's definitely more that can be done there, I'm sure at the local, state, and federal level to address that. Zory, I'm going to turn to you now. Through the Bienestar Estar Bien report, we noticed that the majority of attendees are women and middle age to older age, as I just mentioned a little bit ago. Why is that, and how can we engage men and youth in mental health education outreach?
Oh, I think it's an easy answer, but No es sencilla. A ver,
No, it's not an easy
comúnmente las que
answer. Commonly,
participamos
those of
y
us who
desarrollamos
participate and develop
roles en el cuidado somos las
roles
mujeres.
in
Y
caring
creo que
for other
también
people,
tiene que
it's
ver
the
una
women who
parte
do it.
cultural
And I think this has to do with
donde
our
hemos
culture,
crecido
where
y nos han
we've
enseñado el tema
grown
del
and
cuidado,
they
¿no?
taught us
Entonces,
about providing
quienes
care for
comúnmente
others.
estamos
So
buscando los
those of us
espacios de
who are
información,
commonly
participan en las
looking for
escuelas, en las
spaces for
reuniones, en las organizaciones,
participation,
son
to
mujeres
participate in meetings,
y
it's
también
normally
mujeres
women
de
and
edad adulta. Eso
also
es algo muy positivo
women of
porque
an
mantiene
adult
a las
age. That's
personas
positive
de la
because it
tercera edad
keeps people
vinculadas y conectadas
elderly
con
people
actividades,
linked
porque también
and
observamos un
actively
alto
participate in
número
these
de
activities
personas
because we
de la
also see
tercera
a
edad que
high
pueden
number
vivir en
of
aislamiento.
elderly people who can
Sin
unfortunately live in
embargo, hemos
isolation.
observado
However,
esta
what we've
tendencia
also observed
y
this
este desafío
tendency
en cómo
and this
integramos la
challenge regarding
participación
how we
de
integrate the
hombres en
participation of
estos
men
espacios
in
que
these
sí han
spaces,
participado,
who
han sido
and
los
men
menos,
have
pero bueno,
participated. They are
también
in the
observamos
minority, but we've also
que
observed
quizás
that
en tema,
maybe
reconociendo en temas medicales para
acknowledging
las
that
mujeres,
in
quizás
the
nos es más
cultural
fácil hablar
aspects
sobre salud
for
emocional,
women,
a
it might be easier
diferencia
to talk
que para
about
los
emotional
hombres.
health compared to
Puede ser un
men.
tema
That
más
might
desafiante o
be
puede
a
ser
more
un tema no
challenging
tan
issue
atractivo.
or
Y
an
también
unattractive
hemos
issue.
buscado como
We've
diferentes,
also
ofrecer los espacios en
we've
diferentes
also
horarios, ¿no? Porque
sought to offer these spaces
o
in
el trabajo
different
no les
hours,
permite
different
acceder
schedules,
o
because
la
I can't
distancia.
attend because of work
Entonces,
or because of the
hemos buscado
distance.
como
So we've tried to
cómo
find
abrir un
how
espacio
to
para que pueda
open a
ser
space
accesible,
so that it
sin
can be
duda,
accessible
para
without
las
a doubt
juventudes.
for the
Puede
youth.
ser también un
It
tema de
might be
idioma, porque
also an
estamos
issue of
ofreciendo
language
este
because we are
programa en
offering this
español para
program
que
in
la
Spanish
población
so that
tenga
the
acceso a
population
información
can
en
have
español
access to
y
information in
puede ser
Spanish,
que los
and it
jóvenes se
might be
sienten
that
pues más identificados
the young people feel
en
more
el inglés, ¿no?
identified
Pensando en jóvenes que han
participating
crecido,
in English, thinking about those young
que se
people
han
that
desarrollado
have
en este
grown
país.
up
Sin
and been
embargo,
developed in
hemos
this
tenido la
country. However,
participación de
we've had the
jóvenes
participation of
que no
young
tienen tanto
people
tiempo en
that
este
don't
país y
have
que siguen
that much time in
identificando el
this
español
country and they
como su idioma.
still using
Creo que es
Spanish as their primary
importante
language.
seguir
I think it's
abriendo
important to
los
continue
espacios
opening
para hablar
spaces
sobre
in
la
order
salud
to
emocional,
talk
para
about
hablar sobre
emotional
las
health, to talk
emociones
about
y entender
emotions,
cómo
and
esto
understanding
involucra
how
a todo el
this
sistema familiar, ¿no?
involves the entire
Si
family
papá está
system.
bien,
If
quizás toda
dad
la
is
familia está
okay,
bien, o si
the
mamá está
family is
bien.
okay. If
Si
mom
alguien no está bien
is,
en la
if
familia, pues esto
somebody's not doing
también
well in
tiene
the
un
family,
impacto,
this also
impacta
causes an
también en nuestras
impact
comunidades.
in the
Entonces,
families and in our
actualmente estamos
communities.
llevando a
Currently,
cabo
we
grupos de
are
enfoque con
carrying
ciertas
out focus
especificaciones,
groups with
¿no? Llevamos con
specific,
Centro
with
San
certain
Bonifacio un grupo de enfoque de trabajo con hombres,
specifications,
como
just
para
like
recoger
Centro San
esa
Bonifacio
información
mentioned. We're
en
talking
relación al
carrying
tema
out
de
a
la
working
salud
group
mental.
with men to
Y creo
discuss this issue of mental
que
health.
esto
And I think
abona a
that
lo que ustedes
this
habían venido
adds to
mencionando
what you have been
desde una
mentioning
perspectiva
from a
multicultural, cómo
multicultural
entendemos y
perspective,
trabajamos
where
con
we
nuestras
understand
comunidades,
and work with our communities,
donde
where
no se hablaba sobre la
they
salud
didn't
mental. Yo
talk
siempre
about
comparto,
mental health. I
hemos
always
escuchado
share
más
that
quizás acerca
we've
sobre
heard
salud mental
maybe more
del
about mental
COVID para acá,
health
¿no? Como que fue una
going back
pauta,
from the
pero
pandemic
antes
onwards,
pues
and as if
no se
that set the
hablaba
standard,
tanto,
because before they
no
didn't
se
talk about it that
reconocía, ¿no?
much, or it
Nosotros
wasn't
en México
acknowledged.
hasta tenemos
In
un dicho que
Mexico, we
dice,
even have a
lavando es sucia y se
saying
lava
that
en
says
casa.
we
¿Qué
wash
quiere decir
our dirty
esto? No
clothes at
salgas
home.
a
What does
platicar
this
tus
mean?
problemas, ¿no? Y
Do not
menos
go out
con
and talk
alguien
about
que
your
no
problems
te
in public,
conoce,
in particular with somebody who
o
doesn't
el
know you,
estigma, ¿no?
or the
Que se
stigma
puede
that
manejar en derredor
can
de la
be
salud
handled
mental,
around
que nadie
mental health,
sepa.
that for nobody
Mejor lo
to know.
dejamos
It's
callado para
best
que
to keep it
no nos
quiet so
observen
that
o no nos
they don't
califiquen.
observe us
Me
or they
decían el
don't
otro día en
judge
un
us.
taller,
Or
es
the
que
other
si
day
yo
they
hablo a lo
told me in a
mejor me van
workshop,
a llevar a un
if
hospital
I
psiquiátrico y eso me
talk
da
about
miedo.
this, they'll take me to a
Entonces
psych
es
ward, and
parte
that
del
scares me.
entender cuáles
So
son las
it's part of
dinámicas
understanding
y
what are
cuáles
the
son las
dynamics and
creencias
what
que
are the
nuestras
beliefs
comunidades
that
tienen
our
también para llegar
communities
por ese
have
lado,
in
¿no?
order to arrive by
Antes
that
de llegar
part.
a decirles tienes que
Before
hacer
we tell
esto,
them,
pues
you have to
tenemos que
say, do this,
conocerlas,
we
tenemos
have to
que
get to know them. We
abrir ese
have
espacio de
to open
confianza.
this
Entonces,
safe space.
creo que hemos logrado
I
un
think
trabajo
that
muy
we've been able
positivo
to achieve very
en
positive
el
work
acompañamiento y el
in
ofrecer
the
información
accompaniment and
con las
offering
mujeres,
information
pero
to
hace falta
women's group, but we still have yet to open this path where men are also part of this participation. I don't have data on hand, but I would not doubt when it comes to mental health health attention, the patients, the majority of the patients are women compared to men. And the other thing, just to wrap up, I think that it's also important. These reports allow us to develop in a better way programs or projects when it comes to providing attention or care for the population. So collecting this information gives us a different perspective and say, okay, this worked out this year, so what can we do next year? And without a doubt, I want to mention that when we've had the participation men in these spaces, it has been very positive, a lot of reflection. And this is something that encourages us, that gives us a drive to continue. This is why we developed the videos, which you can also see in our website, where we share mental health stories, whether from men and women, people from the LGBT plus Q population. It's seeing health from a perspective of care, a perspective of prevention, and not seeing from the perspective of as a disease. So this makes it possible to do a different type of work, but we're still seeing challenges.
Thank you, Zory. I think part of the reason we call this Beyond the Silence, or Más allá del silencio, is because, as you said, like, these are not topics that we talk about at home or in public. But when you create safe spaces, as we have, people want to talk, people want to be heard, people want connection. So I think like highlighting that I think stigma continues to be a huge barrier, but when you go in deeper, I think we have progressed a lot in terms of people feeling, I guess, the need to share with somebody in confianza, or in trust, as we say, to try to get connected. I'll share a little bit that we have worked on doing some additional focus groups this spring, focusing specifically on men. So we have been able to hear and learn a few things, and we're very excited to share that later on this year. Jennifer, I want to now move to you for our last question before Q&A. Health insurance and cost of services were among some of the reasons why it's difficult to access mental health support. And I've mentioned throughout the webinar that federal funding cuts have just had an incredible, horrible effect on access to resources. You've shared a little bit already about what Cook County is doing to address some workforce issues. I'm just curious if there's anything more you can share about how the health department is thinking about addressing barriers to accessing services, or any other current upcoming initiatives.
Yes, thank you so much. Yes. So we know that there's a lot going on at the federal level. So what can we do? What can we control? So the Office of Behavioral Health is really looking at it. There's not one solution to how we increase access and address our needs. And so one of the things that the Office of Behavioral Health has done in partnership with community is develop a strategic plan. And that strategic plan has 5 priority areas. One is systems alignment. So how do we improve coordination and collaboration? There's a lot of resources. Do we need more resources? Absolutely. But how do we break down the silos, so that we can utilize and best utilize the resources that we have and connect with one another? Then there's the behavioral health workforce. So workforce issues, we have to address that. We need to build a robust and representative workforce. So as I mentioned and talked about earlier, we're really actively looking at how can we create those earn while you learn pathways. And I mentioned the kind of early entry pathways that we're doing with our apprenticeship model, but we're also piloting a pre-apprenticeship model because, a lot of times, we're talking about how workforce, and it's not just about language, but it's about cultural responsiveness, right? And really understanding where people are coming from. But how can you aspire to be in a position that you didn't even know existed, right? Like how do we build that workforce? So we're also addressing kind of and working with the state on that pre-apprenticeship pathway is to kind of really expose, and working with the state and the Illinois Behavioral Health Workforce Center to start kids, even in high school, looking at like how to introduce them to the behavioral health workforce. And then also, our adults and how they can get involved, even, in their 20s and 30s and 40s, into create pathways for them to enter into the behavioral health workforce. Another priority area, I know I mentioned with children earlier, but is kind of, increasing access to behavioral health services for children, youth, and families. And then increasing access to treatment support and recovery and crisis care for our adults. And so one of the ways in which we're doing through, and Alianza has been part of that, is through our Stronger Together. So we are actively funding organizations across the county to kind of work together to identify, what those needs are and what those solutions are. And to be able to fund that. So that's kind of one of the pathways that we're doing that. Another is that, Cook County is the second largest county in the country. It is a, gigantic county that's full of many, many, many different communities. And so, there's not one solution, one size fits all with every community. So one of the things that the Office of Behavioral Health has done is we've broken up the county into 11 different regions, and we've created regional behavioral health collaboratives so that we can really start to understand at a hyper-local level what those needs are. Like what the needs are in Pilsen are going to look different than what the needs are in Evanston. And where there may be some ability to kind of cross-learning and collaboration, but there can be some very specific community needs. And so we are building these regional behavioral health collaboratives where we can bring together stakeholders, we can bring together our community-based organizations, our government entities, our residents, and really identify what the needs are and create solutions that are community-led, like just as the work that you all are doing, to address that. Some of the work that you all are doing, for example, a lot of it has been discussed about stigma. And while we have come very far from, when I was growing up, there is still a whole lot of stigma. And, we talk about services and therapy, but a lot can happen. You talked about like mental health first aid. Sometimes we don't need therapy, but we need to be able to talk to you and say, hey, you know what, I'm really struggling right now. Or what are some healthy coping mechanisms that I could do to deal with, like, I'm in a hard time in my life and I might not need therapy, but I need some support. And what does that look like? And so I think that, really trying to address that at a community level and really ensure that our residents know, because as we talked about, like the navigating the system can be really difficult and you don't know what door to knock on. So it's like, really working with community-based organizations and residents. So residents know, what are those trusted community sources? Who can I go to in my community, or who can I call? We have 988, we have NAMI Chicago. There's a lot of different resources and doors to open, but sometimes people don't know where to begin. So I think really working at that hyper-local community level to, bring together stakeholders so that they can work together with one another, and also work with residents so that residents know what resources are available. And then when resources aren't available, how can we work collectively together to get those resources into the community where they're needed?
Thank you, Jennifer. It is very exciting, and there have been several listening sessions that you all have been holding on different areas, workforce, SNAP accessibility. I think, as you said, like the hyper local is where we need a lot of groundwork to make sure that what you're coming up with is tailored to the specific communities. Thank you all for engaging in this this part of the discussion. We do have a few minutes for Q&A, so I'll read some of the questions that we have, and maybe we just try to be a little bit brief so we can get to as many as possible. The first question is, ¿saben cuáles son las organizaciones o cómo conectar los que trabajan
What are
recursos
the
en lenguas
organizations
indígenas,
or how to
que es un
connect them with
factor tan
resources
importante?
in indigenous
She's
languages,
asking
which is
if
an
we
important
know
factor?
what are those organizations that we can connect people to that are working in indigenous languages. Zory, perhaps you can share about Cielo or others that we can connect to.
Sí, desde la red de Alianza, o sea,
Yes, within
sí, como
the
saben,
Alianza
tenemos una red de
Americas network, as
organizaciones
you know,
a
we
lo
have a
largo del
network
país
of organizations
y tenemos
throughout the
diferentes
country, and we
organizaciones
have
que
different
vienen a hacer este
organizations
trabajo.
that come to
En
do
California
this
está
work. In
Cielo, en Los
California, there is
Ángeles.
Cielo, in Los
En
Angeles
Nueva York
specifically.
tenemos a
In
Red
New
de
York, we
Pueblos, que
have
también
Red
hace
de
un
Pueblos,
trabajo
who also
muy
does
dirigido con poblaciones
very
indígenas.
specific work
En
with indigenous
Florida está
populations. In
WICOM,
Florida, we have
está
WeCall.
Rural Woman Health
There's
Project.
the Rural Women's
No
Health
quiero dejar pasar
Project. I
ninguna,
don't want
pero
to
bueno,
forget any one of
pueden
them,
visitar
but
nuestro espacio,
you
que son
can visit
organizaciones
our
que han
space, which
venido
are other
desarrollando
organizations that have been
materiales,
developing
información
material
dirigido
and
y
information
acompañando a
directed to these
poblaciones de
populations and
comunidades
accompanying
indígenas, comunidades
population
rurales.
from indigenous
Entonces,
rural
tenemos,
communities.
ha participado
So
también proyectos en Casa Michoacán, aquí
in
en
Casa
Chicago,
Michoacán has
Illinois Workers in
participated in
Action. Entonces, hay
different
diferentes
projects, Illinois
organizaciones
Workers
como
in
parte de la
Action,
red
and
de
there are
Alianza. Si
other
ustedes
organizations as
tienen una
part of the network
organización
of
con
Alianza
base
Americas. If you have
comunitaria,
a
pueden ser
community
parte de nuestra
organization,
red.
you can also be part of our
Thank you,
network.
Zory. There's another one here. Speaking about stigma, you were just talking about this, Jennifer. There is still a lot of stigma. So someone is asking, can you share more on stigma in mental health and how this stigma is reflected within our own systems to negatively affect our mental health service systems? What can community organizations do to work against the stigma? Anyone who would like to respond?
I can take a first stab. I think, like, the work that you all are doing is absolutely gorgeous. I think that sometimes with mental health, we other it, right? We don't want to be associated with it. It's like, oh, that's somebody else. That's somebody else's child that is suffering from anxiety or depression. That's not me. And, I think Alianza has done a gorgeous job with, making sure that it's me. It's my daughter, and how can we deconstruct stigma so that you see, and that's one of the campaigns that we would like to start in the coming years is, and you all have already started it. It's like really with people's stories that you see that it's not just me. And I think that this is really hard with social media, especially these days, because we see everybody's A-roll. We see Zory, she looks great all the time on Instagram, like her family looks perfect. My house is a mess. Like, did you see my laundry? Like, how does she have it all together? And so I think that, like, there's really power in storytelling. I mean, I think humans have been storytellers from the beginning of time. And when we can share that vulnerability with us, that, like, oh, my family suffers. I have several family members that suffer from anxiety and depression and are seeking out therapy. When we can tell stories and we can share with one another, then when we break down, like, the stigma, and the silence, I think that that's what's really dangerous about mental health is we feel like we have to hold it in. We feel like it's just us. And so I think the more that community-based organizations can do the work that you all are doing with sharing those stories and so that others can say, oh, I thought it was just my son. I thought it was just my daughter. I thought it was just me. That is really, really powerful.
Thank you, Jennifer.
Yo quisiera, completamente de acuerdo con lo que
I
menciona
agree
Jennifer, y
completely
creo
with what
que
Jennifer
justo
just
este tipo
mentioned.
de
I think that
proyectos o este tipo de
precisely
programas
these types of
ayudan a
projects or programs
entender
help
qué es el
to
estigma
understand
y
what stigma is
en
and
lo que hacemos en los talleres,
what
¿no?
we do in the
¿Saben qué significa el
workshops. They
estigma? ¿Han
know what
escuchado?
stigma
Y
means.
esto
Have you
cómo
heard of it?
impacta, ¿no?
And how
En el
this
trabajo o
impacts in
en las
the work
relaciones
or
familiares.
the
Y creo que
family
poner en la
relations. So I
mesa
think
el
that
diálogo sobre
putting the
lo que es
dialogue
la salud
on the
mental,
table to
cómo se
discuss what
siente, cómo
mental
se
health
come,
is,
cómo se
how is it
vive, es
perceived,
parte
how is it
de no
experienced, is
normalizar,
not a part of
porque siempre vamos a esta
normalizing,
parte, ¿no?
because
No
we always
tenemos que
go back to this
normalizar
part. We
vivir
don't have
mal,
to
sino lo que
normalize
tenemos es
living
cómo podemos
incorrectly.
vivir bien, pero
Instead, we
para
have to
vivir bien
see how
necesito
can we live
identificar
well.
qué
But
cosas
to
están
live well, I
pasando
need to
desde mi
understand
historia, mi
what's
familia,
happening, whether
etcétera.
from
Entonces,
my past
traerlo a la
history in my
mesa,
family. So
traerlo en tu
bringing it
idioma,
to the
en
table and
español, pues esto
having it in your
permite a
language
que
in
las
Spanish
personas
just allows
escuchen a
people
lo mejor
to
por primera vez qué
hear, perhaps
significa
for the first time,
la ansiedad, ¿no? ¿Qué
what
significa
anxiety
ese dolor de
means, what
estómago? ¿Qué
this
significa
stomach
que no
pain
puedo
means,
dormir o
what
que me
does it
da
means
mucha
that I
hambre?
cannot sleep or
Es
I get
llevar de
very
la
hungry.
mano
It's
para
to
entender cómo viene, cómo
take
se
it with
genera y
you
cómo se
or
puede
accompany it
atender.
and to see how you
Entonces,
can overcome it and how
esta
you can
parte también,
understand
algo que
it.
incluimos
And
mucho
this
dentro de
something
los
that
espacios
we include
de los
within the
talleres es
spaces
cuál
of
es
the
el impacto
workshops
del
is
estigma.
what
Cada
is
vez
the
que nosotros
impact of stigma. Each
estigmatizamos,
time that we
disminuimos las
stigmatize, we
posibilidades de que las
reduce the
personas busquen
possibilities that
ayuda.
people
No, yo
can
no voy a
seek
hablar,
help.
como lo
Oh,
decían,
I'm not
¿no?
going to, like I mentioned
Porque van
before,
a
I'm not going to
calificarme
say it
van a
out loud because they're
señalar.
going to
Y hoy
judge me,
también
they're going
tenemos que
to
reconocer que
point me
tenemos un
out. So now
sistema
we
que
have
nos
to
está
acknowledge
llevando a la
that we have a
invisibilidad,
system
¿no? Que
that
está
is leading this to
incrementándose el
being
miedo, la
turned invisible,
persecución, la
increasing
violencia,
fear,
y
persecution,
con
violence.
estos
So
sistemas que a lo
with
mejor
these
también pues
systems
están
that perhaps are
castigando a quienes
perhaps
necesitan
punishing those
o
who
quieren
need
pedir
it
ayuda,
or
pues
want to ask
aislamos
for
más.
help,
Entonces,
we
desde
isolate
las
even
comunidades,
further.
cómo
So from the
disminuimos
communities,
el
how can
estigma por
we
medio de estos
reduce the
proyectos, pero
stigma
también
through these
desde
projects, but
las
at the same
políticas,
time,
cómo
from
no
the
se siguen, o
policies,
sea, cómo
how
trabajamos
can
para que
we
no
work so
existan
that
sistemas que
there are no
estigmatizan
longer
a la
systems that
población y que
stigmatize
esto
the
pues
population
no
and that
perjudica nada
this
más a
doesn't
un sector,
harm
sino
or
está
affect just
perjudicando
a
a
specific
nuestra
sector.
sociedad en general,
Instead,
porque
it's
todos
affecting our
estamos
society in
interconectados.
general because we're all
Sí,
experiencing
algo más
this.
también que me gustaría agregar
Something
mucho
else
en
that I
cuanto a
would
lo que es
also
el
like to
estigma,
add when it comes
creo
to
que
stigma, I
este
think
proyecto
that
con Alianza Américas ha
this
ayudado
project with
mucho a
Alianza Americas
precisamente
has
dar a
helped
conocer y que
precisely
mucho del
to
estigma es
make
por
this
la
known because a lot
desinformación,
of the
¿verdad?
stigma has
No
to do
se
with
cree
the
en la recuperación, no se
misinformation.
cree
They
en
don't believe
que
in recovery. They
todos
don't
podemos
believe
tener una
that
crisis
we
en
can
salud mental, pero que
all
puedo
suffer a
sobrepasarla.
mental health
Entonces creo
crisis
que el
and we
estigma
cannot
es esta parte de
overcome it. So
desinformación, de creer
stigma
que
is
si yo
part
me
of this
siento mal ahora,
misinformation
si,
that
si yo
we
lo
believe if I
expreso,
feel
me
bad
van
right
a
now and I
juzgar y
express it, I'll
entonces ya
be
nunca van a
judged
volver a verme como
and
yo
they're
soy,
no
como
longer
yo
going to
era.
see me
Entonces
how
es
I
esa
am or
parte
how I
que
used to be. So there's this
ayuda
part
dentro de las
that
organizaciones.
helps within these
Estamos haciendo es
organizations.
ayudar
What
a
we're doing
recordarles
is
que
help to
cualquier
remind
persona
them
puede
that any
tener
person
una crisis en salud
can
mental, pero eso no
go through a
significa que
mental
ya
health
sea una
crisis, but
crisis,
that does
¿verdad?
not
Es
mean that
una
it's a
parte, es
crisis
una
already.
etapa que
It's
se
a
va a
part, it's a
sobrepasar y
stage
que
that
con
will
la
be
ayuda
overcome,
necesaria
and
va a
that
venir
with
la
the
recuperación.
necessary help,
Sin
we
embargo, como
will
lo dijo Zory,
achieve
si
recovery.
nosotros
But just
estamos
like Sodi
estigmatizando
mentioned,
o
if we are
no ayudamos a la
stigmatizing or
población
we
a
don't help the
entender
population
esta
to
información,
understand this
pues va a
information,
pasar eso, la
well, this will
invisibilización, como
happen.
comenta Zory, y no va a haber
We will
esa
be
ayuda. Entonces ahí
invisibilized,
sí se
and
va a
this does not
generar
help.
un problema
And
más
this
grande.
is
Entonces
where
creo
a
que el
larger
problema
problem
es
will be created.
la falta de
The issue
información
has to do with the
que por
lack of
muchos años hemos
information that
tenido
for many
acerca de que
years we've
existe la
had,
recuperación
where
dentro de lo que es
that
la salud
recovery
mental.
exists when it comes to mental health.
Thank you so much. I think that was a great question to finish on. So thank you again to our panelists for joining us today and for the incredible work that you are doing to address many of these barrier issues to access. Thank you to the Cook County Public Health Department and to the VNA Foundation for making this work possible. Thank you to everyone who joined our conversation today. Thank you to our interpreter for helping us make this space accessible. We invite you to read the report on our website, where we are also highlighting several recommendations to funders and to elected officials and sharing more about what next steps are for Bienestar Estar Bien. And also be sure to check out our video series. I believe our staff has shared the link in the chat. It also includes a community guide to how to host community screening events where you can have conversations regarding the videos and how to talk about these topics with your community. We're also excited to share that we are currently working on a second report that will include listening sessions with community members. And in addition, we are also now working, in addition to working with Centro Romero and Centro San Bonifacio, we are also now working with Illinois Workers in Action. We have also shared the emails of our panelists in the chat. We would love to collaborate with you. If you want to learn more about adult mental health first aid, any of our workshops, or just find other ways that we can collaborate, please reach out. Thank you so much again. Take care.
Thank you.